Zika symptoms, how to tell if you've been infected. Florida public health officials announced 10 additional Zika cases have been identified in the Miami area, marking the virus' first known outbreak through the spread of mosquitoes. While federal investigators continue to trace the transmission, pregnant women are advised to avoid travel and exercise precaution in the affected area because the mosquito-borne virus can cause severe birth defects. But for those living in the Miami area and others, how do you know if you've been infected? According to the Centers for Disease Control and Prevention, CDC, those who are infected with Zika may not have any obvious symptoms. Those who do have symptoms typically experience mild fevers, rash, joint or muscle pain, itchy red eyes, or headache, which may appear as a flu-like illness. The CDC warns that symptoms can last for several days to a week. However, those who have been infected are usually not sick enough to go to the hospital. If any symptoms persist after a few days, seek a doctor or healthcare provider to rule out Zika through blood tests and examination. If tests come back positive, the CDC recommends getting plenty of rest, preventing dehydration by drinking fluids, taking a fever reducer like acetaminophen, and abstaining from sex and travel. Although death is very rare, the virus becomes a threat when people do not realize they've become infected. The virus remains in an infected person's blood for approximately 1 week, and because most people won't even know they have it, they may continue to travel and engage in sexual intercourse, ultimately worsening the spread of the virus. Insect repellents and avoiding infested areas are two of the most effective steps to avoid infection. The Zika virus has already infected 9 pregnant women traveling outside the United States, which led to 2 miscarriages, 2 elective terminations, the birth of a baby with severe microcephaly, abnormally small head and brain size, 2 healthy births, and 2 continuing pregnancies. Microcephaly rates among newborns are currently 20 times higher than numbers in previous years, putting pressure on researchers to accelerate development for Zika vaccine.